Okay. So for the past couple days here at the conference, we've been learning about the theme of this conference. How do we build meaningful lives? We've heard from experts in education, international finance, healthcare. We've heard from a number of industries and so much more, as we're trying to learn about not just the world we live in today, but where the world is going. We live in very complex and very challenging times. Over the next hour, we're going to spend our time exploring with our panelists where the world is going in the area of neuroscience engineering. Modern technology has introduced us to artificial intelligence, virtual reality, augmented reality, and so much more. Biology is allowing us to live longer, and the combination of technology and biology has given us immunotherapy, sequencing of the genome, precision and personalized treatment of certain diseases. Now it's time to use technology and science together to focus on the most complex and powerful computer on the planet, our brain. Our brains each contain over 100 billion neurons, and I know the guy that counted them, and I could introduce you to that person, and even more synaptic connectors. It is these neurons that make each of us who we are. They control everything we do and everything we feel. We know neuroplasticity allows our brains to constantly change and generate new neurons. And in this session, we're going to explore the application of modern technology to neuroscience, discoveries that are already leading to increased understanding of the brain and enhancement of our functionality and our approach to diseases of the brain, such as tumors, Parkinson's, depression, Alzheimer's, and others. Our guides for this journey are four extremely brilliant, talented, and visionary individuals. I have no idea what percentage of their brains they use, but whatever it is, they're using it very, very well. And I suggest that we use that 3% that we use to pay attention, because you're going to find the journey very, very interesting. Let me briefly introduce our panelists. On my far right, and the great thing about a non-political panel, you can be on your far right, the far left, nobody really cares. On my far right, Dr. Ed Boyden, professor of biological engineering and brain and cognitive sciences at the MIT Media Lab and MIT McGovern Institute. Dr. Boyden leads the synthetic neurobiology group, has won numerous prizes for his work, including being named a World Economic Forum Young Scientist. He's a scientist, a technologist, with degrees in electrical engineering, computer science, physics, that's from MIT, and a PhD in neuroscience from Stanford. On my right is Dr. Mary Lou Jepsen, an engineer, scientist, and entrepreneur. Mary Lou has used her extraordinary talents to develop and ship millions of consumer electronic products, most resulting from her expertise in optical engineering. Mary Lou headed the display division of Google. She was the executive director of engineering at Facebook, and about a year ago founded OpenWater, a company to make new kinds of hardware and software to see inside our bodies and our brains at high resolution to replace the functionality of the MRI machine at a fraction of the cost, and to use technology to communicate thoughts. Dr. Jepsen has a bachelor's in electrical engineering and a PhD in optical physics from Brown University and a master's in media technology from MIT. And to my left is Bryan Johnson. Bryan is a very visionary entrepreneur. He founded a company called Braintree when he was just 29 years old. It provides online mobile payments, was sold to PayPal 6 years later. Bryan, about a year ago, committed $100 million to his latest venture called Kernel, an effort to enhance human intelligence and reimagine our future with the belief that unlocking our brain is the most significant and consequential opportunity in history. And on my far left, Dr. Neil Cassell, a brilliant neurosurgeon, scientist, and medical entrepreneur. Dr. Kassell is the chairman and founder of Focus Ultrasound Foundation, dedicated to the use of ultrasound as a non-invasive and more effective method to treat a number of diseases. Dr. Cassell was the co-chair of neurosurgery at the University of Virginia. He's a member of the Blue Ribbon Panel of Vice President Biden's Cancer Moonshot, which the Vice President spoke about this morning. Dr. Cassell received his undergraduate and medical education at the University of Pennsylvania. So, let's get started. Ed, let me start with you. You have spent, since you were 17 years old, I believe, studying this area of the brain. So share with us what's going on in your lab today and some of the things you're thinking about that are going to change our lives and help our panelists with what they're doing.
Great, thank you. So it's an honor to be here, and it's really exciting to get to share with you a couple of the things that we're doing in our laboratory. Let's see if I can cue the first movie, please. So one of the things that's useful to do when you're tackling a new area of science is to ask, what's hard about it? And in the brain, there's really two things that are really difficult. One is space. Brain cells are huge, but their connections are tiny. If you want to understand the brain, the algorithms that the brain uses to compute, that generate thoughts and feelings and our actions and decisions, you have to be able to map those circuits. How does information flow? And this is a truly staggeringly complicated problem. Up to you. Next movie, please. Oh, there we go. The second problem is time. So in biology, there are many processes that are slow. In the brain, the electrical pulses that happen within brain cells are very fast, milliseconds in duration or even shorter. And so what we really need, if we want to build technology that lets us speak to and from the brain and to augment and repair brain disorders that affect over 1 billion people around the world, and of which there are essentially no cures and few treatments, frankly, we have to be able to conquer space and we have to be able to conquer time. So I'll tell you two short stories today. The first about space and one about time. Let's start with space. How do you map the brain? It's very difficult, right? Because you have to deal with these enormously varying spatial scales, gigantic circuits of the brain, centimeters in extent, nanoscale connections. So we took a cue in my group from the field of polymer chemistry. It turns out there's polymers, such as those that you find in baby diapers, which are swellable polymers. You add water, as kids do millions of times a day, and they become very, very large. They absorb the water. So in our group, we started thinking, what if we could weave those polymer threads around the molecules and between the molecules within brain specimens? Could we actually start to swell the molecules apart from each other and thereby map the actual composition of the brain, how the wires are connected? So this is basically a little movie showing how it works. We form these polymer threads shown in white. The molecules are in brown in this cartoon. We add water, and the polymer threads, just like in the baby diaper, will swell apart from each other, but now they pull the molecules apart. So it's like you drew a picture on a balloon and blew it up, except it's in 3 dimensions, and it's a brain. So this actually works. This is a little time lapse here of a piece of brain tissue. This is from a mouse. And what we did is add the water to the swallowable polymer embedded brain right there, and I hope you can see that it's starting to grow before your very eyes. This is a sped-up video. It actually takes more like an hour than a minute. But it seems to be even or isotropic all the way down to individual molecules or small clusters of molecules. So one of our dreams now is to make maps of the brain, not just the wiring, but the molecules along those wires. If you could actually make such a detailed map, could you simulate a brain circuit in a computer? Could you generate artificial intelligences that are able to do human-like things, like be creative and ethical and make complex decisions? Could you map out how brain diseases change the brain? We don't know the full set of causes of practically any brain disorder, and if we want to conquer these, it's going to require us to have a deep understanding of these intricate networks and how they change in brain disease states. Now, one of the fun things about brain technology is because the brain is so darn complicated, when you build a technology, it often has a lot of other applications. And so what we've been doing is actually using this method of expanding things, which we call expansion microscopy, to try to tackle other problems, like in cancer. We have a study coming out soon where we can take cancer biopsies, form the baby diaper polymer inside, add water, and blow up a biopsy 100 times in volume. And working with Professor Andy Beck at Harvard, we've shown that actually we can train machine learning algorithms much better when you have 100 times more information than if you try to look at normal unexpanded tissues. And that's because cancers, like brains, are large objects, but with nanoscale changes that you have to understand. So one big theme here is, can we make our technology equal to the challenges of biomedicine and not back down from the challenge, but rather up our game through better tools? Let me tell you a second story about time real quick. How do we control brain dynamics? This is very difficult. Drugs can be used, but those are slow to have effects, and they tend to bathe the brain in a substance. what if we could activate individual cells, really speak the natural language of the brain? So several years ago, our colleagues and collaborators and our group started to think of ways to control neurons with light. Neurons speak using electricity. If we could put little solar panels, effectively, in neurons, shining light at them, which would cause an electrical signal. And then the brain doesn't feel pain. You can bring optical probes into the brain, just like you do electrical probes, which are done routinely to help people with Parkinson's disease and movement disorders. So over the years, we found that little molecules that are found all over the tree of life, in bacteria, in fungi, in plants, actually have this property. They act like little solar panels and convert light into electrical signals. And even more fortunately, they're encoded for by little pieces of DNA. So we can put them into the neurons using any of a number of gene therapy technologies, and then shine light. Light hits the molecule will then activate or deactivate the neuron. So this is in use by literally thousands of different studies that are ongoing or in progress throughout neuroscience. But I just want to talk about one today because it's, I think, an example of how getting down to the ground truth mechanisms can help with new therapeutics. This is work that was spearheaded by Li Wei Sai at MIT using our technologies. And she started to work on a rare cell type in the brain that's atrophied in many different brain conditions. What if you could activate them at a specific frequency? And what this collaborative team found was that if you activate neurons in the brain in Alzheimer's model mice at a certain frequency, you can actually get the brain to jazz up its immune system and clean up the amyloid plaques and other molecular hallmarks of Alzheimer's disease. Now, this still requires genes to be brought into the brain, but the team went on to look at whether we could simulate those effects through the senses. And what resulted is a strategy that we are now commercializing. Li Wei and I co-founded a company, Cognito Therapeutics, that pursue this, where visual stimuli that occur at a certain frequency, 40 times a second, actually can drive activity patterns in the brain through our senses. And the idea is that we can actually use, effectively, movies or other similar kinds of sensory inputs to try to clean up the molecular pathology of Alzheimer's disease. So I'll end there, but this idea that we need to conquer space and time through insights, I think, is really key. And I often tell people the hard part of neuroengineering is often the neuro part. You know, what mysteries lurk within, and how can we understand what's going on so we can repair it? Thank you.
So, wherever you want. Bryan, we've heard about how complex it is, how difficult it is, and yet things that we can do today to make a difference. Why don't you share with us your view? You're very entrepreneurial as to not only whether studying the brain is important, obviously we believe it is, but why do you think studying the brain is important? And what are you hoping to do at Kernel that's going to make a difference in our lives?
Okay, I'll go up here.
Go ahead.
Good morning, everyone. Thank you for convening this morning. Today, I would like to try and make the case on why I think the brain is important. So if we have a scale, we say that'd be nice on one side, and then the other side is important, where does the brain sit on that spectrum? And then what are the contours? So for example, if we just got word that aliens came to planet Earth, we would probably rearrange our daily schedule to figure out what we're going to do. That would be on the important side. Now, if what we're going to have for lunch, it'd be nice if we had our favorite dish. So we saw in the video that progress in neuroscience has been impressive over the past couple decades, that where a quadriplegic could actually move a cursor on a screen by having an electrode on her motor cortex, and she imagines moving her arm, and she squeezes when she wants to tap a letter, which is interesting because we now can understand what neurons are trying to communicate when they fire electrically between each other. The brain became important to me for a couple of reasons. First, personally, and then I think I'd make the argument for all of us. So one, when my stepfather got diagnosed with early signs of Alzheimer's, it converted from that'd be nice to be able to treat Alzheimer's to that is important to me. When my father was largely MIA in my life because he had a drug addiction problem, it'd be nice to help people with addiction became very important to me. When I suffered from chronic depression for a decade, the idea of trying to treat depression was that'd be nice converted to being very important to me. So for several reasons, the brain is highly important to me. But is it important to society? I did a test over the past 4 months where I convened 12 dinners, about 15 people per dinner, some of the smartest people I know. And I engaged in a mental thought exercise. And I said, okay, let's all imagine that we are in the year 2050, and we would like to be happy in the year 2050. Now, that means different things to each of us, but let's just say we want to be happy. What things are important for us to achieve that goal? And without fail, I'd always get the same responses. Well, governance is really important. We need a good functioning government. Healthcare really matters a lot. Climate science is important to address. Education matters, et cetera, et cetera. It was basically that we have this shared vocabulary as a society of what do we collectively agree is important? Like what demands resources, time, and attention? Not once in over 250 participants did a single person identify the brain as important, which to me is the biggest blind spot we have as a species. For everything we are, everything we aspire to become, everything we're trying to do is a result of our brain. Everything. If we're trying to solve cancer, if we're trying to do work with Ed Boyden in microscopy, everything we do is a product of our brain. So why it is not number one on our list could be a variety of reasons. It could be the case that we have a lack of social proof in society. So it is the case, for example, when I choose to listen to music, I do not scrub the world of upcoming artists and try to determine who I'm going to listen to. I generally accept who I'm told to listen to. I accept what others consider to be important in music, same thing with art. It's the case that there have not been voices in society who have blessed the brain to say it's important. Most of us live in a world where we are told what is important, which I think is what's interesting about Milken. So this morning, Joe Biden made an impassioned plea about why cancer is important, why that should be given special treatment above all of the things we could work on. So I want to give you a couple arguments on why the brain would be important to you, absent your own personal experience with yourself or your family members, why we would collectively contemplate the brain being a top priority for us. One is it is a trend that automation and artificial intelligence are getting better at doing a lot of things, which includes better than humans. And that has been a consistent trend for quite some time. And if we've learned anything from history, it's that when we say, oh, you know what, like that's a special skill I have, I'm not at risk, we see it again and again where our new forms of computational intelligence do things human can do and better. So that trend will continue, which will put enormous stress on our society about what humans do, how we make meaning, what purpose we have, how we differentiate ourselves from the workplace, how we retrain ourselves to learn new skills, how we interact with our machines at work. Like, what is the future of humans in the job place? Number two, there's an emerging complexity in society. Like, we have a difficult time as it is managing all the difficult things we have in the world. And if we look at the rate of technological progress, it's reasonable to assume that the complexity we will have to deal with will only increase in our individual lives and as a society. We need to figure out how to allocate resources, how to resolve disputes, how we decide on morals and values, et cetera, in order to keep the social order. And I would argue that in our current configuration, individually and collectively, that we are bumping up against the upper limits of our ability to manage complexity, which creates enormous risk for the human race. Three is that we have unlocked the power of computational intelligence, which means that an engineer can sit down at a computer and write code to create intelligence via software systems. And there are no barriers to entry to do that. You don't have to get regulatory approval. You don't have to go through the skull. You just sit down and code. And if you look at the velocity of development in computational intelligence, what we call AI, it's impressive. If you map that out over the next 10 to 20 years, it's really impressive. So I am not the one to put in the camp and say AI is coming to get us, but I would make the observation that it's increasing in capacity, and that the basic observation that intelligence is the most powerful and precious resource in existence. And we've made ourselves the model of intelligence, our conscious form of intelligence, but it's the case that this unconscious form of intelligence is increasingly capable, and the velocity is fast. It's not the case, however, that I say, oh, my friend Joe in 1980, now if you look at a human in 2017, now has a memory that's 1,000 times better. Human intelligence is landlocked. We can read books, we can drink coffee, we can meditate, but we are a fixed form of intelligence. Our tools just get better. And the delta between how fast we're proceeding with artificial intelligence And human intelligence is something I think we should pay attention to. Fourth is this idea of evolution rights. Humans always use the most powerful tool available to them to accomplish a given objective. And it is a case that we are building more powerful tools for humans to do things. For example, genetic enhancement via embryos and increasingly into adults. Biological enhancement, physical forms, and potentially even neurological enhancement. As these new tools come online, and the procedure to do so, the demand will increase substantially. And nation states will decide what to do with these technologies based upon the ideological disposition. So we saw an early stage of this where we saw progression with genetics, with CRISPR. And in the US, we had this debate where we're like, well, we're not really sure it matches with our ethics and value, our ethics and morals, so we're kind of not sure what to do. And China said, yeah, we're pretty interested in that. And so nation states are starting to break, and I would not be surprised in the coming years if nation states start raising their hands and say, you know what, we are the home for human potential. Bring your technologies here. Finally is aspiration and ambition. Humans have always created their greatest masterpieces when anchored in aspiration and hope, not when drowning in fear. And so a couple what-ifs to imagine. What if I could read and comprehend those 72 neuroscience papers on my desk in a single afternoon? What if I could learn new skills 5 times as fast? What if I could correct for my biases, illogical behaviors, and lack of discipline? For example, when I ate that cheesecake last night when I said I would not do it. What if I could control the time and duration and quality of my sleep? What if people with different viewpoints could connect their emotional responses, reconcile, and cooperate better? What if President Trump could tweet directly from his brain? Wait, sorry. Scratch that one. What if the cognitive fatigue suffered by judges, politicians, doctors, and CEOs could be optimized so they'd be better managed? What if I could, when I put my 7-year-old daughter to bed at night, what if I could spin up a tale as epic as Harry Potter or the Lord of the Rings to make it look like a beginner's guide to creativity? What if we could expand the biological limits of empathy and care to include 8 billion people instead of our immediate family and friends? What if my dad's addiction could have been fixed? What if we could treat my stepfather's Alzheimer's? What if I could have avoided a decade of chronic depression? Most importantly, what if I can't even imagine 99% of what-ifs that I could ask if we could actually read and write our neural code? And if history is any guide, it is true that we simply cannot imagine 99% of what's going to happen, what is possible. So for example, at the invention of the printing press, who could imagine what ideas would be written about? At the invention of electricity, who could imagine what we would one day power? At the invention of the internet, who could imagine how we'd connect? I wonder sometimes if one of our best arguments for taking control of our cognitive evolution is one that first seems somewhat paradoxical, that our present failure to imagine the possible benefits of cognitive evolution is precisely why we need it. I'll end it with a personal note on something that is potentially sensitive. So why do I care about this so much? So one, I have 3 children, and we are the beneficiaries of thousands and thousands of years of humans who worked very hard to make this world possible. Some were productive in their efforts, and some were destructive. But we're the beneficiaries of that. And it is our responsibility, of course, to deliver the same to those who are coming after us. 2 is I love being alive, and I've got a lot of plans. I have a lot of things I'd like to do. And 3, I grew up in an intensely religious family and community where I was told there was a God. And this God, I was told, was in control, that there was a master plan, like someone had it all taken care of. And so anything that happened, whether it be a death in the family or someone got sick or there was a personal setback or something debilitating, everything was always okay. There was someone in charge. And I was told that if I obey the commandments, if I play by the rule book I was giving, I get heaven. And in heaven, I'm with my loved ones and I have unlimited creative abilities. And we don't really know exactly what happens in heaven, but you don't want to miss out on it. It's pretty awesome. So my job in life, obey the commandments. And what was going to happen? The world was going to head towards inevitable destruction. And with that, the heaven will be taken care of for me. Well, when I left my religion, it was a sober moment where I realized there was no one, well, for me, I opined there was no one in charge. And then I concluded, when I concluded there's no one in charge, I thought, oh goodness. And then, with this new lens, I surveyed all my knowledge of human behavior. For my fellow humans, who I now depended upon to achieve whatever I care about in life. And I thought, uh-oh. So I find myself continually thinking about the movie Arrival, when aliens showed up to Earth, and they said, hey guys, we need your help in 3,000 years, and you're going to destroy yourselves if you don't upgrade your operating system. So let us do you a favor. Here's the code. Get that thing uploaded, and you're good. I oftentimes wonder, when we imagine everything we care about, everything we aspire to, and each one of us aspires to different things, how would we achieve that? Within that context, I would ask you to contemplate, how important is the brain? Where does it stack anywhere else? In the case in starting Kernel, it was me who had to write a $100 million check to get started in an extremely challenging field. I have no idea if we can succeed. $100 million is just enough to seed it. But it's not the case that I could have gotten the money from a venture capitalist. It's not the case that government would write me a check to do it. It is not on the radar. And until recently, until Elon Musk announced Neuralink and Facebook announced they have some interest in doing this, it just was not on the radar. I'm glad it finally is on the radar. And I would submit for societal discussion that we should contemplate very carefully, because if we don't accurately identify what's important and work on it with sufficient lead times, I think it could put us in a very challenging spot. Thank you.
Okay.
Oh, left there?
So, Mary Lou, we've learned about the complexity, we've learned things that can be done, and we've certainly learned why it's important and all the what-ifs. What is the what-if that you're working on right now at OpenWater? What are the uses you think of the products you're going to want to develop that are going to help us in our leading a more meaningful and better life?
All right. So I was at a party Friday night. It's a good way to open, maybe. And the legendary New York Times tech journalist, John Markoff, approached me and asked me a question. What's going on with brain-computer interfaces? Like, you've been working on this for a while, but there's this cacophony of people getting involved, which I find very exciting, as I think we all do. The people on this panel, Elon Musk announcing, Facebook, my former employer, announcing. It's pretty exciting. But let me backtrack a little bit to why that question's so interesting. I've been talking pretty publicly about a vision I have for non-invasive brain-computer interfaces, leveraging the high-volume consumer electronics manufacturing infrastructure of Asia, and to bring them pretty rapidly to millions of people. And while that probably sounds, and I get accused of this kind of quietly behind my back sometimes, stark raving mad, it's not, and I'm going to explain to you why it's not. But for the past 5 years, I've had these vaunted positions at Google, where I ran advanced engineering and advanced consumer electronics for Google and then for Facebook. I know a lot about consumer electronics. I've shipped billions of dollars worth of product now for decades and designed things on the hairy edge of physics that lots of people bet against. Luckily, we've got Sand Hill Road that bets into contrarian viewpoints. I love Sand Hill Road in BC. Bet into me, and I've achieved these things. And so I put my money where my mouth was about a year ago and left my position at Facebook to found a company, a new company completely dedicated to creating non-invasive brain-computer interfaces that could also dramatically lower the cost of medical imaging, multi-million-dollar medical imaging systems like MRI and CT and PET. And so I've been doing that now for about a year, and it's pretty exciting what's happened in the last month with Elon Musk announcing it, and Facebook, my former employer, announcing it, the amazing work done by people on this panel for decades, and the shoulders that we stand on of the astonishing work in the university for decades that enables us to come to this moment now where several companies are saying it's time to commercialize something. And so now we've gone from maybe some of us up on the stage, me being perceived as stark raving too, to the whole lot of us, because we're talking about this, but we don't have a product prototype. Nobody does. So here's the thing. what I'm here to tell you is it's not stark raving mad at all. The reason I'm talking about it, and the other people can speak to why they're talking about it, is because this is coming. And we need to define what it means to be responsible and ethical as we take this march to this last bastion of privacy inside of our heads, of our thoughts. We are the sum of our thoughts and memories. And we're about to open our brains like tin cans and dump them on a sleeping world. And I'm trying to help. That's a Peter Gabriel quote. He's quite poetic. But that's what is about to happen. And I'm up here today to tell you the physics of my approach is solid. This is inevitable. This is going to happen. And the reason a lot of us are talking about it before the product prototypes are ready is because it does require such a change. And so specifically, let me talk, if we go to slide 26, there's the next talk up. I can talk a little bit about the approach we're taking at OpenWater. And the basic idea is to try to do what a lot of people have been doing, using cutting open skulls and putting needles in the skulls for decades and showing some pretty good progress. I've been really focused, before I dove in to do this, to find a non-invasive approach. And a non-invasive approach for two reasons. Number one, if you think of doing elective brain surgery for millions of people, I think it's a non-starter. Do I need to explain more? Okay, great. Number two, even if your cell phone's off, people can spy on it. So if you've got an implant in your head and you want privacy to have some private thoughts, with a non-invasive solution, you can remove it. So I thought fundamentally a solution had to be non-invasive. Well, we have a non-invasive solution that already works for reading low-resolution thoughts now. It's called functional magnetic resonance imaging. Those big tubes you lie in if you've got a bad headache or a torn ACL or some issue with you. You lie on it, you hear the pings. They're multi-million-dollar machines in the most expensive rooms in hospitals. But if I threw you and you and you and you into an MRI machine right now, I could tell you what words you're about to say, what images are in your head, whether you're paying attention or not, whether you're in love or not, and so forth. Just by looking at the use of oxygen in your brain in 10 cubic millimeter voxels, those are 3D pixels, just by looking where oxygen is used and applying big data analytics. That's relatively low resolution. So the question is, who wants to lie in an MRI machine all day? Not most people. So how do we reduce the cost and size of this? And there's been a lot of work done in using near-infrared light to do this. So near-infrared light, what is that? Our bodies are translucent to that part of the spectrum. It looks solid when we look in visible light because our eyes see visible light. But if you put on night vision goggles and illuminated the room with near-infrared light at light levels lower than are outside right now here in Los Angeles on a 10 a.m. on a sunny day, our bodies would look like, scatter the light like lemonade or milk. And so the way people are using near-infrared light to get crisp images traditionally is by using super fast cameras. Cameras that measure time of flight of the light. The light is going at the speed of light, but some light gets through your arm or your brain faster because it doesn't ricochet around in the scattering medium, the lemonade or the milk. Some get straight through, less than 1%, but with that you can get a pretty decent image, but not that deep. What's been shown by one group is about a centimeter of depth, so when you get through the hair and the skin and the skull, you got a couple millimeters left, with about a millimeter resolution. So that's pretty cool, and with that people have gotten speech and other things. But that's not where I'm trying to go. So what I'm trying to do, can we go to slide 26? Anybody? Oh, great. The approach that we're taking at OpenWater is one that images our entire body with much higher resolution than MRI, that can reach the neurons, look at the blood flow, also drastically reduce the cost of high-resolution medical imaging. And it uses the wave nature of light. like the waves in this pool. These are the ripples from dropping a rock in a pool. The ripples radiate outward. Those look like waves. Light has a wavelength. It's about 100th of the width of a human hair. But it's a wave. We can think of it as a wave. So here's the thing you can do when you can record the wave, or what they call phase. Phase is just, is it a peak or is it a valley on these ripples? If I shook the sides of the pool with pixelated kind of shakers that were about the width of these wavelengths, call it an inch, wavelength, the peak-to-peak difference, I could reconstruct that ripple pattern and make the ripples converge on the point where I dropped the rock. If I dropped 1 million rocks in the pool, I could shake the sides of the pool and reconstruct the ripple pattern of 1 million rocks, 20 million rocks. What that's called, there's a fancy term for it in optics. It's called phase conjugation. And that is possible with holography. Holography measures the phase and intensity of light. It's the only thing we know how to do that. So we can take a picture of an object in 3D and collect all of the light that came off of or transmitted through an object all at once, all together. And holography has several meanings. I'm meaning holography, the thing that won the Nobel Prize in Physics in the early 70s. There's holography like Tupac appearing on stage in Las Vegas. That's literally smoke and mirrors. So that's a different type of holography. There's also, it's used as a marketing term in the latest push in virtual reality and augmented reality, where those are two 2D images presented to the eyes. So this is capturing all of the light. So now imagine I use near-infrared light to capture a hologram of my arm or brain, the scattering of it, catch all of the light, then reconstruct it, do that phase conjugate, shaking the walls of the pool. With that, I can then focus the light down to a point and look at what's happening at that point, whether there's oxygen or not, whether there's a tumor or not, and so forth. This is a static hologram made in film. To do that, to raster scan our body and to deal with the fact that our body's moving, we do need to do this with a video camera, not 100 billion frame per second video camera, a video camera at the rate of the speed of the cameras in your smartphone, which is about 100 frames per second. So as I said, I've been doing this a long time, not to date myself, but as a graduate student at MIT in the late 90s, with a team of graduate students, we built the world's first holographic video system. So I made a system by hand with 1 micron pixels. A micron is 1,000th of a millimeter. Displays at that time were millimeter in size, but by making these small pixels, they were approximately the size of a wavelength, so I could reconstruct the full wave patterns. So now, fast forward several decades and billions of dollars worth of products and screens that I've shipped, and I'm making LCDs, new LCDs, liquid crystal displays. Using the manufacturing process improvements I've helped put in place for the march for smartphones, for high-resolution screens on your phone, that have in turn been reappropriated to make the new virtual reality systems and the process improvements being put in place for the next generation virtual reality systems. I think I'm the first person to make a screen that's not designed for your eyes to look at. It's designed to line fabric, like a ski hat or a bandage, and be illuminated with infrared light to see deep inside of your body at higher resolution than multi-million-dollar MRI machines that enable us to communicate with thought, to share ideas, to diagnose brain disease, to find tumors, to see where clogged arteries are, and so forth, in a low-cost, wearable way that can scale to millions of units. Our goal is to hit millions of units in less than 5 years and scale to hundreds of millions of units after that, because we can use the existing manufacturing supply chain. So, LCDs that look like this, just in case. I know there's different acronyms in the financial community for LCDs and MRIs. It was market something investment. So MRI, magnetic resonance imaging. So here's the thing. With this, we're getting a ton of depth. Our entire bodies, we're right now at 100 microns of resolution at 4 inches of depth and about 5 microns of resolution at 1 inch of depth, which means we're in reach of neurons. And we know that by illuminating neurons with infrared light, we change the capacitance. So we're talking about reading the state of your brain, but also being able to write things, surgery without a knife, so to speak, on your gut, anywhere, with these new tools that can be made incredibly low cost. And so I know, as fantastic as this sounds, I want to ground you and explain, really, it uses the tools of our time, big data, AI, and the consumer electronics manufacturing structure. There's $400 billion of sunk cost in the manufacturing supply chain that makes the screens in your phone, and that's what we leverage. So I'm very excited to explain this to you and really try to get in front of the exhilaration we feel for bringing this online, and also some of the trepidation we feel about trying to define what it means to do this responsibly and ethically. Thank you.
So Neil, as you listen to this, you're the one person up here who has actually cut into the brain as a neurosurgeon, yet you've decided to commit yourself to the new foundation of focused ultrasound to do non-invasive treatment of different diseases, including diseases of the brain. Explain to us what led you to do this and what you're accomplishing today and what you hope to accomplish in the future.
Do you want me to answer that now, or do you want to see the...
Do it
story?
Let's see your presentation first.
Well, first of all, my children are going to be thrilled that I was introduced as being on the far left of anything. Thank you.
It was not an accident.
We just heard something about, there's a burgeoning field that involves the biological effects of physical energy. We just heard about light. Another one is sound, and that's what I'll be talking about. So focused ultrasound is a early stage, very early stage, non-invasive therapeutic technology that has the potential to be as revolutionary to therapy as MR scanning has been to diagnosis. So if it proves out, it will be a big deal. So imagine, what if you could treat a patient with a malignant brain tumor with sound instead of, or in addition to, surgery, radiation, and chemotherapy, and thereby extend their life from 1 to 5 or 10, or perhaps even more years than that. It sounds like science fiction, but it's very much, the potential very much exists today. And it's something called focused ultrasound, again. So this is a real example of what's happening today. So in the bottom pane, you can see a left-handed 64-year-old architect who's had his career compromised by essential tremor, which is a cousin of Parkinson's disease, for more than 10 years. And you can see his attempts at drawing, not really good for an architect. So he was one of the first patients treated with focused ultrasound for this disorder. So the pane that just came up is an MR scan of his brain that was taken immediately prior to the treatment. And the blue dot deep in his brain is the target of those abnormal nerve cells that are firing away uncontrollably, causing the shaking. So he went into the focused ultrasound device, wide awake. He received no drugs, no incisions in his scalp or holes in his skull, and the target was treated with 1,028 intersecting beams of ultrasound energy. At the end of the treatment, his tremor was completely gone. Another MR scan was performed, which showed that the target had been totally obliterated. He could draw for the first time in more than 10 years. And here's a video of him 3 months later showing the durability of this treatment. So how does this work? Well, the principle is analogous to using a magnifying glass to focus beams of light and burn a hole in a leaf. But with focused ultrasound, instead of an optical lens, an acoustic lens is used to focus multiple beams of ultrasound energy on a target, in this instance, in the brain. And where each of the individual beams goes through the tissue, it has no effect. But at the point where all the beams converge, at that focal point, there are a number of interesting and important effects on the tissue. And the point in the brain where the ultrasound is focused is guided by MR scanning. And then the nice thing about it is that the treatment is controlled in real time by repetitive MR scans taken through the target every second. So you can see the changes in the tissue as they're occurring. And the changes are immediate and verifiable. Unlike radiation, the effects of radiation are invisible while it's being administered, and it takes weeks or months for radiation to become effective. So at that focal point where the beams converge, there are a number of biomechanisms that are relevant to the brain. The tissue can be destroyed either by heating it or by non-thermal mechanisms. Drugs can be delivered in extremely high concentrations, precisely to the point in the brain where they're needed. Much higher concentrations than can be achieved either with oral or intravenous administration, and also greatly minimizing the systemic side effects or complications. The blood-brain barrier can be reversibly and focally and repetitively opened to allow administration of drugs or stem cells. Tumors can be treated with focused ultrasound to enhance their immunogenicity and thereby help with the administration of the new immuno-oncology drugs. Tumors can be pre-treated with focused ultrasound, which decreases the amount of radiation necessary to treat the tumors by at least 50%. And then focused ultrasound can stimulate and block neural activity in voxels as small as 1 by 1.5 millimeters. The fact that there are so many different mechanisms creates the opportunity to treat a whole variety of disorders. The number of disorders in various stages of development is increasing rapidly. Currently, there are 15, and let me highlight a few. So the essential tremor that we showed you has been approved by the FDA. It still has yet to achieve commercial insurance reimbursement. Parkinson's disease, like essential tremor, there are pilot clinical trials ongoing to control the symptoms of Parkinson's disease, and there are a plethora of preclinical studies to control or treat the underlying pathology that will allow restoration of function. Glioblastoma, opening of the blood-brain barrier to allow administration of higher concentrations of chemotherapy. Those clinical trials are ongoing. Immunotherapy for glioblastoma, preclinical. Benign pediatric brain tumors ongoing. Treatment of drug-resistant depression and OCD. Clinical trials ongoing in Korea, soon in Canada and the US. Epilepsy. And the first 4 patients have been treated in a very, very, very early stage pilot study of opening the blood-brain barrier for treating Alzheimer's disease. And it's a long shot, but nothing else has worked for Parkinson's, for Alzheimer's, so that's that. So the introduction of any new, early stage, highly disruptive, game-changing technology is confronted with a number of challenges. There's still some engineering work to be done, nothing to be discovered. It's really, we're in the development, not the discovery phase. We still need a lot more evidence of safety and efficacy to satisfy the patients, the physicians, the hospitals and clinics that purchase the equipment, the regulatory agencies, and the payers. There's some regulatory issues. Many of these indications that I showed you are combination therapies, and the pathway through the FDA is still a little bit bumpy for those. And then there are cultural issues that are associated with the introduction of disruptive technologies, fairly fierce turf battles between the specialists, the physician specialists. Having said that, we're at the beginning of a difficult road that will take us to the point where I believe we can non-invasively improve the quality of life and longevity of life and decrease the cost of care for countless people with the most devastating disorders afflicting mankind.
Thanks. So in the few minutes we have left, we've covered a lot of territory here in a very short period of time. Ed, why don't you tell us sort of where do you see us going in the next few years that's going to affect all of us? I know that Ray Kurzweil, who's the director of engineering at Google, he's predicted it won't be that long before we have nanorobots basically going through our brains. We create our own individual algorithms. What does that do, and what are the benefits that we're going to get from that? And how soon are we going to see it?
Well, I think nanorobots have some really serious engineering challenges, which is why none of us talked about them today. The power source is a really big problem, right? So the batteries that you could make that small would run out very quickly. And if you're to deliver power from afar, you'd have to somehow capture it, and that's as daunting a problem. So throughout this little seminar, I think people have talked about all sorts of different ways to couple power, information, and to couple it to the circuits of the brain, right? The anatomy of the brain. Anatomy sounds like an old-fashioned word, but that's really about how the structure of information is encoded in three-dimensional space in the brain. And so I think that technology is changing so fast, so it would be foolish to say that nanorobots will never happen. But I think one has to sort of see, if we hope for the neurotechnology industry to enter its exciting growth phase in the years to come, to think about sort of the pipeline of how these different technology trends feed into these areas. And so I think today you've heard a couple different examples about things that are going to be happening in the next few years that could really have a lot of impact on a lot of lives.
Well, I'll ask for any of our panelists. We have a lot of money for the first time going into this area. And I know we've just sort of scratched the surface. But, you're talking about, Mary Lou, within the next, 3 years, delivering some of the products you're talking about coming out. And, and I know that you're doing a lot of work in this area over at Kernel. So, in the next 3 years or 5 years, what do you expect that we can expect that could affect our lives and that we can understand, basically?
Oh, where do we think we can go? I mean, low-cost MRI for medical imaging, and then talking about what we want to share of our thoughts, because there's kind of privacy and ethical issues. We can do it, but just because we can do it, should we do it? Clearly, for the billion people with debilitating brain disease, between mental disease and neurodegenerative disease, there's a pretty strong case of real-time monitoring of that can be made. I want to be able to dump the images of my head out. I think we can speed up everything we do once we get there. But in the next 3 years, how far are we willing to take a step as a society?
Well, as I dump out the images in my brain and other people are reading it, do I have any control, or is it a complete dump? And why do I want to do that? How's that going to help me if I, unfortunately, have one of these diseases?
If you want to dump how's it going to help you? It's going to help you amplify yourself to do your work. Right now, if you're an architect, you have an idea for a building, it takes years to build it. What if you could use the robots that are building a building in a day, connect it to your brain, and just build it? What if Hollywood, 2 miles from here, could Directors could dump the movie directly from their head as a rough cut. It could just speed up our productivity and what we could accomplish. But yet, we're going to have to deal with, we're probably going to need kind of training lessons in how to be comfortable of being open and honest and exposed with our thoughts hanging out there.
It's the head of Singularity University said, it's not artificial intelligence that I'm worrying about. It's human stupidity. Okay. Bryan, what do you think of that comment?
Yeah, I think as you heard from my previous comments, I think the frame that matters is what does the human race look like in 2050, 2070? And I think we are really at this unique time and place in history where that question is extremely relevant. And so in contemplating that, there's a certain reach of technologies we can look at today. And I don't think it's a question of should we. I don't think it's a question of will bad things happen. Humans have never been able to stop the progression of technology. No technology, despite how destructive it is. We are incapable as a species of doing that. The only question is how do we be as thoughtful as possible? But I think the frame needs to change because it changes the ambition on the kinds of things we go after. And we're doing invasive because I think getting access to the source code of human intelligence, which includes everything that we are, is the only contemplated way we can imagine the human race in the coming decades. So it's an imperative in how I see it.
So, Neal, why don't you leave us with something positive that's happening today? When you talk about delivery of chemotherapy, explain how that works. How do you deliver basically very strong drugs to where they're supposed to go without causing all the side effects that we have today through focused ultrasound?
Okay, let me use Alzheimer's disease as an example. And again, this is a long shot, but the blood-brain barrier exists to keep toxins and bacteria and viruses from getting into the brain. But unfortunately, it also keeps drugs, important drugs, like for Alzheimer's disease, from getting in adequate concentrations. So what limits the effectiveness, and I think that there are good drugs for Alzheimer's disease, they've all failed in clinical trials because they don't reach the brain at adequate concentrations, because you can't give enough of it without creating toxicity throughout the rest of the body. So focused ultrasound could open the blood-brain barrier focally in the areas where Alzheimer's disease is beginning and get the drugs in much higher concentration than is currently possible today. That's a simple example. You can extrapolate that to Parkinson's disease and to brain tumors as well.
So we're moving in a very positive direction. We got a ways to go, but we're getting there much faster than anybody could have imagined, I'll guarantee, 10 years ago. And when we do this session 10 years from now, we're going to do it. I'm just going to sit here. I'm going to wear this little cap that Mary Lou's going to make for me, and we're going to have a good time without me ever opening my mouth. So with that, thank you for joining us. Enjoy the rest of our conference, and I thank all of our panelists.